So, Dr. Terry, tell me a little bit about your practice. Where you're located, who you see. Are you doing virtual visits now? What's the emphasis of your practice?
Okay. I'm a neuropsychologist in specialty. I practice in Hemet, California, licensed throughout California to practice psychology. I have a huge following of patients who have traumatic brain injury. Being a psychologist, I focus not basically, but primarily on how to facilitate care through treatment with patients who are suffering from concussions and scar tissues that culminate, from these concussions. Seeing vets, definitely. My practice includes veterans. And then I see patients of degenerative diseases. My referral base, about maybe 30%, 40% of it comes from physicians and insurance companies. A lot of that definitely has to do with ongoing chronic complaints that physicians can't seem to narrow down any longer. They're having all these PET scans and MRIs, and they can't find anything going on. And I never doubt my patients that they're hurting, because they are. That's what takes them to the doctor.
Correct.
But some of that hurt is emotional and mental pain. And it's, they do have physical scar tissues or scars that create some of these problems, but the discomfort is there, but the pain it runs deeper. And so many of them you can't take care with medication. And I've always been one to think out of the box anyway, not definitely traditional in my way of treating.
What's the primary life issue right now that you're seeing that is uniquely affected by the novel coronavirus?
Well, as a general rule, change is difficult for people.
Mm-hmm.
And so the adaptation to change even becomes harder when there's a crisis. And so COVID-19 is definitely, we're in crisis.
Right.
And it's affecting not only small numbers of groups or people within groups, but the mass majority of the population in the world. Mm-hmm. So it's real. And so change is very difficult. Not only do you have to deal with the emotions, but then you help them go through this to the next stage, which is their rational mind. You have the emotional mind, then you have the rational mind, and then you have the wise mind. And so that's how I progress in treatment with them. And it's not going to be overnight. It's not going to be months. It may be years. Yeah. Those who cope well with crisis use different mechanisms, and not only brain mechanisms, but tools. They actually revert to tools that they've utilized and don't even recognize that they're utilizing it. So someone who is doing better adjusting to this pandemic will start with limiting their exposure to the media, the news media especially. A lot of people want to turn it on. You remember if 9/11, where everybody was watching it for hours and hours and days and days. And that's the worst thing that anyone can do, because it feeds into the cortisol in your system, and it just keeps you anxious. That anxiety even increases all the more.
Fight or flight is peaked all the time. You can't rest, you can't relax.
Exactly right. You can't relax, you can't sleep, you can't, and that's why I speak about these two hormones in particular, which definitely behave like neurotransmitters. So they take over the system, and too much is not good either. So that's why I'm saying you go to that balanced state, and part of that is what you do behaviorally.
Now let's hear about your top three of what myself or anybody else can be doing during this lockdown to sort of, if we talked about the vessel, lower that stress level that's in our vessel?
Okay. Like I said, there are some basic things that we need to be doing anyway on a daily basis just to
Sure.
lower the stress level. And that would be exercising, making sure that you're eating nutritiously. We can deviate from that once in a while, but not on a regular basis. Meditation is extremely important because that increases oxytocin and reduces cortisol also. It gives you the body needs to relax. It needs to sleep. And if you don't have those working in your system, it's going to create havoc and it will affect you physically. So, like I said earlier, the media, TV is, in some people's lives, that's really important. That needs to be minimized. Those who are successful with this cut down on the amount of media.
Right. I don't watch it at all. Let me ask you a question about meditation, because I think there's this presumption that I get myself into some, Dalai Lama position and try to just become one with the world. But I think there are probably many ways that someone can meditate. So for example, I go out on my bike, and when I'm out there, my brain just goes free from everything. And I really get into a meditative state. Is that legitimate, what I'm talking about, or is that faux meditation?
No, that is meditation. It comes in different ways. And you could be walking and just breathing. Breathing is a form of meditation. And, you take in a deep breath of oxygen and purge your lips to exhale the carbon dioxide. And just listening and be rhythmic with it is another form of meditation. A lot of people go to yoga for that. Running used to be a meditation way for me. I used to be a marathon runner, and I overtrained and injured. And so,
Me too.
and so unfortunately, it's not something that I readily do. But biking, I think hiking, people go and hike. They and do it as a ritual. It's got to be part of your lifestyle.
Right.
Something you just pull out of the hat and say, hey, I'm going to go and ride a bike today, or hey, I'm going to go and walk a mile today. No, it's got to be ritualized. And I think that's where people miss the boat, and they're in crisis, is that they deviate from what is normal, because it isn't normal. It isn't normal to be in a crisis. And you need to say that it's okay to feel these things. It's okay to be overwhelmed. It's okay to be anxious. It's okay to be uncertain. It's the uncertainty that takes us beyond that, because we don't have all the answers. So exercise is extremely important, but be ritualized in it. Structure your life. Structure your daily life. So it is important that you try to make your life at this time as normal as possible. And that's just not you. If you have children in the house, they live in a chaotic world right now, and they're taken out of school, and that's so ritualized. If you remember going to school, from 8 to 2, and you know what you have to do during that, you can't wait until you get out of there because it's so structured, so you go out and play and do things like that. But children are really experiencing some stress levels that people aren't recognizing. So we're going to have more and more children who are going to have reactions to this shutdown, this lockdown.
Dr. Terri, do you have any parting comments, any final comments that we haven't discussed that you want to throw with the audience right now?
I think in all of this, I think there are two types of post-trauma. One is post-trauma growth, and then post-trauma disorder. So as I'm reflecting, as you're talking, and reflecting on what we just talked about, those who go towards post-trauma growth are definitely those who have skills and are able to be much more resilient to that,
Wow.
to the COVID. But even any kind of crisis, they're going to bounce back anyway. And then those who are definitely more fragile are going to stay within that traumatic syndrome. And so it's those who are not able to move forward to growth that are going to be so susceptible to other infections. That's my concern. So there's the physiological side to all of this that's induced by their psychological fragility.
But if we can get our body in harmony, which is the term you've used many, many times, then you have a much greater chance of, I forget the exact term, but you said there are two paths you can take post-trauma, post-pandemic, and that is a path of more trauma or a path of more resilience. And that's what we're trying to achieve.
Correct. Yeah.
So,
Great. I've loved this. This is great. We should have more of these.
well, we're going to, I hope. Terri, thank you so much for your time this morning.
You're welcome.
Grab another cup of coffee if you imbibe, and
I am.
we'll talk to you again real soon.
We'll see you Friday.
Thank you so much.